I've had probably two major flus in my life. One was at the age of 29, and that was very scary because I had a temperature of up to 41, which was very, very scary. You're almost delirious when you have that kind of temperature. And the second one is actually only like a little bit more than 2.5 years ago. And I had so many different complaints that I never knew I could have with flu. Not just the fever and the aches and pains, but all sorts of different gastric complaints came with it. And only after about 4 weeks, my eustachian tubes were swelling up and I felt like my head was underwater for about 5 to 6 weeks. And I have to say, because the whole thing lasted about 9 to 10 weeks, it really got me down after a while because I didn't feel that I was getting better. And I really thought I don't ever want to have something like that again. So when I then had the opportunity to get vaccinated, I jumped at the chance, and I have done it ever since. And I've barely had a cold, although vaccination's not even supposed to be against colds, just against the flu. When the ear thing started, that's when it really started getting me down. It wasn't the full-blown flu symptoms, but sort of the after symptoms that lasted for such a long time. And it sort of life became a bit of a drudgery because I was just not feeling well. I felt sort of, because when you can't hear properly, you feel quite distant from people, and it just started getting me down. I wasn't my normal self for actually probably, well, I mean, the entire time, but it got worse halfway through the whole thing. And in a funny sort of way, that had almost a worse effect on me than the actual symptoms, because you get flu, you get better, but because it took such a long time, and it might be because I'm older now, that I get a more severe form of it, because you just don't know. They always say older people suffer from it more. I wasn't particularly worried about getting a flu vaccine. I just thought that it probably wouldn't work anyway, in a strange sort of way. That's what I thought. And then after having that horrible flu, I thought I really need to try and prevent this from happening, because it makes life a bit of a misery for a period of time. And as I say, I then went for the flu jab, and the first time I had the injection, I didn't feel a thing. I didn't even feel the needle go in. It was amazing. Second time it hurt a little bit, but only briefly. It really is. It's no big deal. I'm not needle phobic, but it is no big deal. But I don't like having blood taken and stuff. The flu vaccine is easy peasy. I think it's important, I mean, obviously to prevent myself from getting ill, but I think also to make sure that I don't pass this on to other people around me. And particularly working in a hospital, there will be so many vulnerable people on our wards, and if I pass this on to colleagues, I sit in an office. I don't have patient contact, but I have lots of colleagues who I come into close contact with who do have patient contact, and I could infect them. They don't know they have it, pass it on to the patients. And I mean, in extreme cases, it can kill vulnerable people. So I think particularly in that setting, it actually is really important. But I think we've just seen through this COVID pandemic how when we're unprotected against something in our environment, how lethal that can become for some people. And I think that's really brought it home to me as well.